sitakuacha milele. Akili zangu, nguvu zangu, nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu, shida zangu, ziangalie Kenya yangu. Tabu zangu, shida zangu, ziangalie Kenya yangu. Ninaimba siyo wimbo, ni maombi. Nikiomba Mwenyezi Mungu aibariki Kenya yangu. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu, nguvu zangu, nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu, shida zangu, ziangalie Kenya yangu. Tabu zangu, shida zangu, ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini, sisi zote binadamu. Matajiri masikini, sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno siyo tikiti ya mbinguni. Utajiri majivuno siyo tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Plani zako twazijua, lengo lako twalijua tu. Plani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya yangu usijali ukitukanwa na jirani. Kenya yangu usijali ukitukanwa na jirani. Yeye anaona wivu kwa vile ume.
By myself, on behalf of His Excellency, the Governor of the County of Kisumu, Professor Peter Nyanyu, on 31st January 2025. Yeah, so on this day, the 31st of January 2025, on behalf of the Governor of the County of Kisumu, Professor Peter Nyanyu, I cut this ribbon to officially open the new refurbished Accident and Emergency Department at JOOTRH.
Where are the board members? The board members? Board members? Okay. Yes, now we are 4. 1, 2, 3, 4.
Very good. No, very good job here. like a pen that is not pen. That is not ink.
That's not in here.
Give it to you to sign this one. Yeah.
Yeah, here, supporting all these years.
Well, they must be more than 7.
Yeah. Dr. John probably is doing failure.
And Dr. Gam.
Really? More than 7.
That's okay.
Yeah, more than 7. And I already started this and Dr. Umur is taking some. Since 2017, they've been here every 3 months.
Yeah.
So I really supported our community. So you learn what is a state data. So, Your Excellency, let me ask Dr. Unor, who is the officer in charge of this department, to take you through the tour of the facility. And we run something.
Thank you very much. This is the information and registration desk. Start trying the next place is
First information should pay me.
station, and then this is the place that patients are trying. This basically means to categorize the patient according to the agency. It's immediate, 10 minutes, 20 minutes, 30 minutes. So after that, after categorizing them that way, then you move them inside. Registration desk, the engine is admitted, then the point, the sharp, then we also have other insurances, Madison, BON, and all that. That's their desk. And then you have other friends, Equity, we have their agents here.
And they supported us in
walking patient and queue here. That is a categorizing. And these two are patients who are on registration.
So we have these are consultation rooms.
Oh. They were here before.
Yeah, they were. Now we have doctors. An exit.
Let the three of them only go in.
Students.
This year? Yeah.
generally for a resuscitation area, the nurse is just there, the nurse in charge, and it's face to patients to resuscitate. All this. Yes. So all these places patients already have patients. So as we proceed, some patients.
So they are treating children from the other side.
This is acute, but where they live, when I begin
Monitors, we have them on the other side? Yes, yes.
patients at the station, there's some patients who will want to monitor for one period of time. We have a short stay water. This will be our short stay water. With oxygen monitoring. After categorizing them as specialties, one here as well as specialties their reviews can be done.
So you sit together on the
Yes, yes. Not the ICU.
lights like the one that was down the bottom now.
The one that was down is here, but that space we're going to purpose something. There are some services we're looking for, but we can transfer the others.
And how many of these children have
We have around 10.
Then we are getting more space, but at the end of it, we don't have alone for staff, the doctors and nothing, where they can rest there. So we can have space for them.
But the beauty about this also, the consultants have a space where they can work.
It's going to be more comprehensive.
the nurse station is here, like it was just
Good gesture.
Then we also have a room for consultants, for reviewing, their patients, they want to assess. So they have a use of we have a small battery room there now.
so now we don't have any patient that requires.
Yeah, the patients are being processed. We don't want them to stay here for long.
There's no single time that I've come to JOOTRH where they are keeping me
We still have patients, but the patients who are walking who are not ready.
We are connecting oxygen now.
Right now it's still portable. That space that the oxygen piping is still there.
So you invite them. And then now from here to our ICU.
There's a path. They're going It's small, huh? So the idea here is to have it as a complete trauma theater. Yeah. With all the equipment that is needed. So that if you are to be operated, you operated here, awaiting transfer to the ward. By the time you're going to the ward, it's just a continuation of treatment. Yeah, but you're not awaiting anything.
So this is your only to be here.
The space is still big. There's still a lot of space that we still need to repurpose. We have a lot of room for renovations and getting more space for medical services.
When do you intend to operation on this?
It's completed. We are on.
This theater, this.
By next week, it will be ready.
Next week we already have
Not
some.
necessarily for all the other questions, but at least for minor.
Yeah.
Yes. It was just because of the pain. By then it was working even before.
Yeah.
So it was just because of pain.
Yeah.
Otherwise, we sleep
The
by
first one is working.
This light. It's on.
No, it's on and off.
Yeah.
Enough space for room. Then right there, through the window you can see the oxygen manifold. And once it's complete, we pipe it, but we also pipe the oxygen to the main plant from all the plants.
So we would have seen that here, both 10 of them, I think. Yes, they can consider them in 25.
Just planning.
The other wing, once we covers the other services that we like it, X-ray, MRI, CT scan, all of that. Once we get
Yes.
Yes.
Able to get equipment.
Yes. CT scan again. But this needs to ultrasound. So that we have a comprehensive, A and B. Almost every facility.
once you're walking through that door, you're not going out of that door and staying. You're just going to the kitchen. That's it.
There's a lab with the pharmacy.
You have a lab here in the pharmacy.
This is the next building. That's the next building.
So we will collect in that samples here, and then we just have to
The main lab.
just
Main lab is just
yeah. And then medically transmitted to
So then you print from here. So the doctor has
yes, yes.
So all doctors have
there's a computer you can see on the
all controls.
Yes, yes.
Oh, good. Oh, it's better than the day. So we can
Lives in front of you.
There's an opposite
So the lab space is also online.
So pharmacy is just the next building. So we didn't see the point of transferring services.
You may need emergency medicine somewhere around there.
No, of course emergency medicine is up to there in the emergency room.
But if there's need, we have enough space. In fact, we need to be a pharmacy. Yes. We can also have another.
I wish you had a pharmacy with you.
Yes.
So that there is just when you walk in, if you have to walk out, you know.
That's point taken.
Doc, thank you very much. I'll come back with you.
Yes, so many. Go to the last position.
Please just give us.
I'm getting 20, so please.
Give us 500.
Five will give.
So yesterday, going to the wards, we have already extended this one.
Oh, yeah.
So we can just use them MRI. Yeah. And then we are going to reach them. Yes, they kind of have to reach them. So we do we say this thing 10 days ago. Yes, we use it. So the next improvement we have got 7 on placement. The most yes, but now we are doing a list.
Yeah.
What are you doing?
This way, exit. So these are very modern. They remove more toxics and decrease the length of life. Yes. Yes, Dr. Nina,
This is where it belongs.
that's where it belongs.
This is where it belongs.
Okay. Yes. Good to see your team.
These are teams.
Everyone.
So, Pamela Self with the nursing in charge of Keynote. Then we have Madam who is the overall in charge of the education in terms of nursing. We have a medical engineer who is around. So what we start off, we start off just getting the education, and then we will get to
Pamela, take over.
Okay. So we have two sides of the unit. This side A and this side B. Yes.
Nyamrundu ni mbele tu chini ya nani. Samana. Chana na dopo. Idanya ka. Papuli. Ya mudu man.
We are meeting for the next session. Yeah.
How can the singer?
Told them. Twice a week for everyone now. Able to take up the that. So this side here we have a total of 7 machines on this side and 7 on the other side. So initially we started with these ones and now we have the HDF ones. And they are total 7. This side they are 2, the other side they are 5.
These are the ones that are new.
Yes, the ones that are new. 2 this side plus 5 plus 4. This is our isolation room. This there are 2. 2 this side, 5 on the other side. This is our teacher. We serve our patients with this is our pantry. This is a good one. Just before, it is very high protein, quality meat. This is our nurse's office. This is our pantry room. After finishing the procedures, we bring our
na kama hiyo process ni ngumu, unaweza kumashauri kwa email yao, WhatsApp namba ama upigie kalenda. Alafu gari lapataje? After story yake imepublishiwa, hapo ndo unanisimu watu unafuatilia. Bro, au umenichambua. Not just when it's from you. Part of breaking it. Down to the digital app. Catching your story. Strange reporting today.
And what do you use for infection control, for cleaning?
The floor we use JIC. Yes.
What percentage? Yeah, 6%, 4%.
Yeah, 46. 46. So this is side B. These are the new machines. 1, 2, 3, 4, 5. Plus the other 2, they make 7. So total, we have 17. The daily number of patients that we have, and average 15 total. Per day, an average of 20 sessions. Yeah.
This is very impressive. You know, very, very impressive. This is like, you know, being in a private facility.
Thank you.
Yeah, you get treated with dignity.
Thank you.
Dignity. You know, this is what you need in most of those high-end facilities. Yeah, so I'm happy that this is available.
Thank you, sir.
That's what I see.
You've seen the progress in terms
Yeah.
of privacy.
We purpose restless. Ensure that we go and do this by this. So we have started, and the next area we want to do is maternity, our maternity mother and paper, and we want, at least by the end of this year, we see we have had this privacy for all our patients. It's very key, and this one gives dignity to our clients, and also gives ample time for the staff as they serve the patients. Yeah.
In fact, sir, I would say with confidence that we are able to do even more even if we get more space, because we have 17 nephrology trained nurses.
Yeah, and that was going to be my next question.
Right here at the moment, we are 12. But in the whole hospital, we are 17. More to come. Yes, we are training.
How about critical nurses for the ICU?
For nurses, that's why we have a challenge.
Critical nurses, we have 18.
18 also?
Yeah.
Okay, all of them engaged?
All of them engaged, yes. For the county, there are 16, and then we have 2 who are enrolled by JOOTRH.
Yeah.
So a total of 18. And then ICU total right now we have 34 nurses. So the rest have learned on the job and they're able to give the services. So any shift, we make sure that we have an ICU trained nurse working with the others.
But you have a training for ICU?
Yes, yes.
Oh, I'm just here.
Yes, yes.
We have also training in
Okay,
ICU.
that means the senior ones can also be.
Yeah.
Yes.
Okay. So SHAC covers for the patient.
For
Shark covers
dialysis,
for
yes.
dialysis.
For dialysis,
But
yes.
ICU,
For ICU,
it's only bed.
it's only the bed.
But here they're covered.
Here they are covered.
They are covered. So
We have all commodities, everything. Yeah. In fact, the leasing guys are the ones actually who are giving us
Did you not tell us about the new machine? What is it about?
That is why I think we are here.
So it's not just dialysis machines we are talking about. So dialysis is something that people have been doing for a while now, and it's done all over. But our machines that we are having, we are talking about hemodiafiltration, HDF. But in a simple term, what we say, if a patient has kidney failure, we say the best thing for them is transplant. We want to push all our patients and we're working towards that. But as we prepare that possibility, we need to be on dialysis. Now, hemodiafiltration of HDF machines, the ones we have additional benefits than what the regular machines do. And here we're talking about better clearance of the waste products in the body. And there is medical evidence that translates to longevity of life on dialysis. So you are looking at also giving them a better lifespan as they are on dialysis. So that's part of our aim with what we want to do with the new therapies. This therapy currently is available in very few select centers in this country. So in private hospitals in Nairobi, 2 units have it. MTRH has been doing hemodiafiltration for some time, and now with the other unit who are doing it in the public. So it's a great milestone for us, and we look towards increasing our capacity and improving other services in the renal space. Congratulations. Get through? Yeah. Okay. Thank you. Excellency, we took Dr. Nina to training program.
Usijali ukitukanwa na jirani, yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke.
Hope you enjoy.
Thank you. Thank you. Thank you.
Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Mwarifu twakuona tu, mwarifu twakujua, mwarifu twakuona tu. Kulani zako twazijua, lengo lako twalijua tu. Kulani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Ukitukanwa na jirani, Kenya yangu usijali. Ukitukanwa na jirani, yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke. Wimbo ninaimba, oh, siyo wimbo ni maombi. nikiomba Mwenyezi Mungu aibariki Kenya yangu. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu, nguvu zangu, nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu, shida zangu, ziangalie Kenya yangu. Tabu zangu, shida zangu, ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele.
Quality, affordable medication is on course. Today, on behalf of the Governor of the County of Kisumu, Professor Peter Nyang'nyong'o, who is our vision bearer and our leader, we have just, opened the new Accident and Emergency Department, at Jaramogi Oginga Odinga Teaching and Referral Hospital. Now, what we have seen in that facility that we just opened is a complete departure from what we had here in the past, meaning that the patients who are seeking medical attention here will get it in a more friendly and a facility that's better equipped, and so the treatment outcomes from the current accident and emergency center will be far much better than what we had here before. I want, on behalf of the Governor of the County of Kisumu, Professor Peter Nyang'nyong'o, to applaud the team here. The County Cabinet member, of course, in charge of health, Dr. Ganda, is here, and of course the CEO of Jaramogi, the Honorable Dr. Richard Lesiampe, for a job well done. But other than the accident and emergency, which I believe that all of us toured and we are going to see what rests in there, we have also visited our renal department and commissioned it. In the past, we've had facilities there, but the equipment that we have there, 7 in number, brings the number of machines that we have there to 14. But I think there is something very special about the 7 that we've just commissioned today, and it is the fact that it is one of the most modern, actually probably the most modern dialysis machine. We have 7 of them at JOOTRH. Not many facilities in this country have them. Not just in the public facilities, but also the private facilities. And so we are confident that those who have been seeking care here, and by there they come from all over. I've been able to interview the patients who are in there. Some of them come from as far as other counties, not just Kisumu. And so again, we are talking about treatment outcomes. It will be much, much better with the current machines that we have than what we've had here in the past. So basically what we are saying is that JOOTRH is better equipped right now to operate at the level for which we are seeking her elevation, a level 6 facility. And we hope that is coming as soon as possible. Today in the morning, I had a meeting with a staffer from the Treasury. I want our people to know that in as far as the Ministry of Health is concerned, JOOTRH is already operating at a level 6 facility. But then Treasury needs to give a nod so that the requisite budget, to this institution can then be channeled here. So that's the only thing that we're waiting for. I think I thank the team here, because if they were to come and do any other assessment other than the one that they did, they'll be very shocked at the highest level of care that can be attained from this facility. So that's all that I want to say for now. And my minister is here, the CEO is here.
So I think we're going to implement this.
Are you guys coming there?
Yes. Yeah?
Adwa ni awach gi dholuo, adwa ni awach ni kawuono ne wabiro e osiptandwa maduong' mar Jaramogi Oginga Odinga Teaching and Referral Hospital. Wabiro mondo mi wayaw ayanga kar thieth manyien miluongo ni accident and emergency. Kama kiyudo masira mora mora obed mar apaya kata mara mora tikuongo ikelie mokwongo. En kama olos manyien kendo nitie masinde manyasani to gi gimoro amora manyalo dwarore hospital moro amora ng'ato nyalo dwaro dhiye. Ne wan gi machalo kamano accident and emergency machon to koro ne waneno notin kendo ok obedo kama ber kama ji nyalo yudo thieth maber. Koro omiyo ne waket kama nyien kendo ang'eyo ni wantie ne wasedhi kanyo kendo waneno kaka ochalo kendo koro anyalo wacho ni ng'ata ang'ata moyudo hinyruok moro amora e kaunti ma Kisumu kata mabiro e osiptal kamuok kamoro amora dhi yudo kony maberie moloyo kony mane giyudo chon. Adwoko erokamano bende e lo ngire ma gavana ma Kisumu ne minister mar thieth Dr. Greg Ganda to kod jachung' kaka CEO mar Jaramogi Oginga Odinga Teaching and Referral Hospital Dr. Richard Lesiampi kuom tich majaber magitim. To kane waa kanyo to bende wadhi kamiluoke remo kata gidho gima luongo ni dialysis, kamitime dialysis. Ne wan ga gi mashinde 7 kanyo. To wamedo mashinde moko kendo 7. To mashinde 7 momed sani go gin mashinde manyasani ma tin osiptande manie Kenya ka ni kodgi. Osiptande matin ahinya mani kodgi. Omiyo adwoko erokamano kendo ago milome ne jowa manyalo dwaro thieth mar luoko remo kata dialysis gi dho ngere ni koro sani wan gi mashinde manyasani kendo wan gi mashinde go mang'eny koro chon ne gin 7 sani koro gin 14. To bende wan kod jolony kata renal nurses ma bende osethiedhi ma osepuonji kendo koro konyo e thieth ma koro yudore e dala mar ang'owa mar Jaramogi. Atieko kawacho ni gombo maro maduong' en ni Jaramogi Oginga Odinga Teaching and Referral Hospital obedie hospital machalo kaka Kenyatta kata machalo kaka Moi Teaching and Referral Hospital kaluwore gi kaka okawe gi sirikal mang'wa mamalo madhongre luongo ni level 6. Ministry nche no oseyie mondo wadhi e level 6. Koro sani warito wach mowuok e treasury mondo mi wayudo muom madhi miyowa watiyo gi pesa go hospital ni kaka hospital moko bende tiyo Kenyatta kata ma hospital Moi Teaching and Referral Hospital. Ka kamano to erokamano ng'ata ng'ata matuo manyalo dwaro thieth moro amora in thuolo mondo mi biyud thieth e hospital ma wantie sani.
Thank you very much. My name is Dr. Gregory Ganda. I'm the County Executive Committee member for Medical Services, Public Health and Sanitation. Today I'm really proud about what JOOTRH has done. We have been doing a lot of work in trying to improve the services to put JOOTRH at the level of a level 6, offering specialty services. And today we have seen one of the great specialties that is being introduced, renal specialty. A few years ago, we sent some of our doctors for training in South Africa. We had a physician who went to train in renal medicine, and we have a second physician to South Africa who is coming back early next year. We also started a training in renal nursing, and we have 12 trained renal nurses. And because of that, we have improved, we are starting to get returns for our investments. One, the renal physician has come back with better technology and newer technology, and the kind of dialysis you have seen, the 7 machines that the DG has talked about, are actually only there in 3 facilities in this country. One is MTRH, there's a private hospital in Nairobi, and Kisumu becomes a 3rd facility with this HDF machine. The beauty about this new machine that has been installed here is that it has been found to make people live longer, because people with renal disease usually are chronic illnesses and they have a lifespan. So we try to improve that lifespan, and HDF machines have been shown to improve the number of years that these people can live. The second thing we have done is that we have trained a urologist. Now we have 2 urologists back here, and that means then that the transplant program is on course. We are hoping that JOOTRH should be able to take up the transplant, having now the requisite consultants to be able to do that. Usually dialysis is not the best kind of treatment because it forces a client to be in the hospital for 3 days in a week, and that day then they cannot be able to work and they are not productive. And so that is why kidney transplant has always been touted to the best. It is more expensive usually when you are doing the surgery,
But in the long run, if you look at it, it is more cost effective, because then a client just needs to come back once in a month to pick up their medicine and continue their care. And it has also been found that their care actually, they live longer because of those factors, because of the economy and the other socioeconomic factors that surround being able to work. So that is the ultimate that JOOTRH will reach, and we hope that by next year, after all this infrastructure and all these things have been set up, we should move towards being able to do kidney transplant. Thank you very much.
I think we have a gentleman here who has a word for you. You know that from 2017, Jaramogi Oginga Teaching and Reference was holding neurosurgical camps where we get experts, especially from the United States, to help alleviate the suffering of our people. Now that camp is ongoing as we speak, and we have one Dr. Victor. Thank you. Okay, and I would like for him to say a word to you so that you get to know exactly what they are doing.
So I'm Dr. Victor Ward, neurosurgeon from Ohio Health Grant Medical Center in Columbus, Ohio. On behalf of the Neuroscience Initiative, I'd like to thank the Deputy Governor, the CEO, the Governor, and everyone in Kisumu County for allowing us to be here. We started this project back in 2017. We started doing surgeries in 2018. And I think the biggest part for me, the joy that I'm seeing is that now I can actually watch a lot of the surgeries. And I don't have to do every single one of the surgeries because we've trained some of the orthopedic surgeons here. We now have a neurosurgeon at Jaramogi. So there are a lot of residents that can do a lot of the procedures. And that's the goal. The goal is not just to come and do surgeries and leave, but to educate so that once we're gone, the surgeries can continue to happen without us being here. So it's been such a joy to see that the surgeries can continue to happen even when we're not here. Any questions?
Thank you very much. Thank you very much. Asanteni sana. Thank you. We meet at Best Western.
Matajiri masikini yo, sisi zote binadamu. Matajiri masikini yo, sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno siyo tikiti ya mbinguni. Utajiri majivuno siyo tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Kulani zako zazijua, lengo lako twalijua tu. Kulani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya yangu usijali, ukitukanwa na jirani. Kenya yangu usijali, ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji, naye azidi kuporomoka, wacha yeye yaporomoke. Naye azidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke. Ninaimba siyo wimbo ni maombi, nikiomba Mwenyezi Mungu aibariki Kenya yangu. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu nguvu zangu nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu shida zangu ziangalie Kenya yangu. Tabu zangu shida zangu ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini sisi zote binadamu. Matajiri masikini sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno siyo tikiti ya mbinguni. Utajiri majivuno siyo tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Plani zako twazijua, lengo lako twalijua tu. Plani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. ukitukanwa na jirani. Kenya yangu usijali ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Amekuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke. Ninaimba sio wimbo ni maombi. Nikiomba Mwenyezi Mungu aibariki Kenya yangu. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Akili zangu nguvu zangu nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu shida zangu ziangalie Kenya yangu. Tabu zangu shida zangu ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini sisi zote binadamu. Matajiri masikini sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno sio tikiti ya mbinguni. Utajiri majivuno sio tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Kulani zako zazijua, lengo lako twalijua tu. Kulani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. harufu yako twaijua hata ukipanda ndege, harufu yako twaijua tu hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya yangu usijali ukitukanwa na jirani, Kenya yangu usijali ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea, yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji, anakuita nyang'au, amekuita mnyonyaji. Naye azidi kuporomoka, wacha yeye yaporomoke. Naye azidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke, wacha wao waporomoke. Ninaimba oh, siyo wimbo ni maombi. Nikiomba Mwenyezi Mungu oh, aibariki Kenya yangu. Kwa jina la Baba na la Mwana oh, kwa jina la Baba na la Mwana oh, Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Akili zangu nguvu zangu oh, yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu shida zangu oh, ziangalie Kenya yangu. Tabu zangu shida zangu oh, ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Matajiri masikini oh, sisi zote binadamu. Matajiri masikini oh, sisi zote binadamu. Kupayuka, tusahau majivuno na tuache kupayuka. Utajiri majivuno ya mbinguni, utajiri majivuno sio tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. twakuona tu, muharifu twakujua, muharifu twakuona tu. Plani zako twazijua, lengo lako twalijua tu. Plani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya yangu usijali, ukitukanwa na jirani. Kenya yangu usijali, ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji, amekuita mnyonyaji. Naye azidi kuporoma, wacha yeye yaporomoke. Ewe Kenya inji yangu, Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya wewe baba yangu, Kenya.
So that we may be ready when the chief guest will be arriving. Ninaimba oh, siyo wimbo ni maombi. Nikiomba Mwenyezi Mungu oh, aibariki Kenya yangu. Kwa jina la Baba na la Mwana oh, Roho Mtakatifu amina. Kwa jina la Baba na la Mwana oh, Roho Mtakatifu amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Akili zangu nguvu zangu oh, nimeziweka mbele yako. Bibi yangu na watoto oh, nimewaweka mbele yako. Tabu zangu shida zangu oh, ziangalie Kenya yangu. Tabu zangu shida zangu oh, ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Matajiri masikini oh, sisi zote binadamu. Matajiri masikini oh, sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno siyo tikiti ya mbinguni. Utajiri majivuno siyo tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu, mwarifu twakujua, mwarifu twakuona tu. Kulani zako twazijua, lengo lako twalijua tu. Kulani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya yangu usijali, ukitukanwa na jirani. Kenya yangu usijali, ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke. Wimbo ninaimba, oh, siyo wimbo ni maombi. Nikiomba Mwenyezi Mungu, oh, aibariki Kenya yangu. Kwa jina la Baba na la Mwana, oh, Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana, oh, Roho Mtakatifu, amina. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Akili zangu nguvu zangu, oh, nimeziweka mbele yako. Bibi yangu na watoto, oh, nimewaweka mbele yako. Tabu zangu shida zangu, oh, ziangalie Kenya yangu. Tabu zangu shida zangu, oh, ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Matajiri masikini oh, sisi zote binadamu. Matajiri masikini oh, sisi zote binadamu. Tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno siyo tikiti ya mbinguni. Utajiri majivuno siyo tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Plani zako twazijua, lengo lako twalijua tu. Plani zako twazijua, lengo lako twalijua tu. Wataka kunyamba
O God of all creation, bless this our land and nation. Shield and defender, may we dwell in unity, peace and liberty, plenty be found within our borders. Mashariki tuwezeshe kuishi kwa amani, tutimize na malengo yetu, jumuiya yetu sote tulilinde, tukiimarishe umoja wetu, ni nguzo yetu. Can you come over and offer a word of prayer?
Let us pray. Father God, in the mighty name of our Lord Jesus Christ, we thank you and we honor you. As we gather here today, O God, we are thankful, O God, for your doing. We are thankful for the leadership, and we are thankful, O God, for the entire staffs that are here today, and even the community members and every other person who has made this day be what it is. God, we thank you. We humble ourselves, my Father, as we start this day. May you start with us. May you lead us. May you guide us. May your will be done in our midst every day for the glory of your name. For this is my prayer. In Jesus' name I pray.
Amen. Tuseme amen. Amen. Let's assume our seats. Our guest of honor this afternoon, the Deputy Governor of Kisumu, on behalf of the Governor, Dr. Matthew Owili, our brother, the County Commissioner, the CEO, Jaramogi, Richard Siambe, the CS, County's Executive Committee member, the Chair of the Committee, the Chair of the Board, Board members, and all the guests. Good afternoon. God is good. Allow me to welcome you to this wonderful program of the launch commissioning of the strategic plan for the year 2025 onwards. It's a clear indication, guest of honor, that the hospital has moved a notch higher, and following what you have seen this morning, it tells you that the management and the board of members are doing a good job at Jaramogi Oginga Odinga Teaching and Referral Hospital. Round of applause for them. Allow me to invite the CEO, my friend, Dr. Richard Siampe, to come over and make his opening remarks and also recognize some of his team. Dr. Tumpigie makofi.
Your Excellency, the Deputy Governor, Kisumu County, Dr. Willie, the CEC for Medical Services, Dr. Ganda, the County Commissioner, Kisumu, my brother Lepar Morijo, the Chair of the Board and Board members of Jaramogi or JOOTRH, in short, distinguished staff from the county government, my own colleagues from Jaramogi, our stakeholders present here, and particularly the members of County Assembly, led by the Chair of the Health Committee, Ananyagongo, the community, particularly from Kondele. We also have from Kosao, we call it the Kosao community. We also have the community from the city of Kisumu, our businessmen and our businesswomen. We also have also very, very important stakeholders who are also our suppliers. Your Excellency, the team I have here from our hospital also includes staff from the farewell home. You know, we also have very junior staff, even those who are support staff representing the rest. We also have the unions and the associations that work in our hospital. So, mine this morning is to welcome you and appreciate you for getting time to come and launch the JOOTRH Strategy 2024-2029. We know that you have a very busy schedule. We know that you have so many competing interests, but you have always been available when JOOTRH calls you, and we want really to appreciate, your presence all the time. We have not a long day. We want to make it a little bit short. I want to once again to thank you for opening our Accident and Emergency Center, which is indeed the largest in East and Central Africa, and we believe that the great clinical outcomes will come out of that. In fact, I was the CEO of Kenyatta National Hospital, and even my staff were there last week. Some of them, we cannot compare themselves with what we have today. But what is very important is the clinical outcomes of it. We also commissioned the dialysis machines. Now we are going to have about 18 dialysis machines in the hospital, and those 7, which are HDF machines, are actually the only ones modern, in this part of the world, and even some of the private institutions not have it. But what is very important, we are not competing with anyone, is to see to it that we have great clinical outcomes. So for today, I want to make a very quick presentation. I don't think you can see it all there. There's a synopsis of our strategy, and I will not go through the presentation. Your Excellency, a strategy is a direction. It gives the future. It gives the roadmap of where we want to go. So for us at JOOTRH, we want in the next 5 years to be the best referral facility in specialized healthcare in this part of the world, and in fact, if possible, in Kenya. And we are determined to do that if we go through this strategy. A few things that we have decided to do was actually to coin a new vision for ourselves. And our vision now is to become a center of excellence in specialized healthcare services. A center of excellence in specialized healthcare services. And I can tell you for free, Your Excellency, we got the support from our minister, who, as we speak now, we are probably the only national referral and teaching hospital that is 80 to 90% focused on referral specialist services. In fact, KNH, I want to compare them, MTRH, KU, they have not managed to do it. And this has been a dream of His Excellency Professor Nyang' Nyong'o when he became the Minister for Medical Services. He indeed wanted all the referral hospitals in Kenya to focus on specialized services.
to have resources focused on specialized conditions, to have the staff, the employees, focused on those areas, and then the other facilities to manage primary health care. So I can tell you without fear of contradiction that JOOTRH today is the only referral hospital that we have managed to have specialized treatment 80% and none other. And we intend to continue making it 100% going forward in the next 5 years. Your Excellency, our outcome and our motto is excellent clinical outcomes. So whatever is in this strategy is that the only reason why an hospital exists, the only function, the only core business, the only purpose is to restore people's health. No any other business. To relieve people's pain. In fact, all the other activities that sometimes we engage in, buying patients' uniforms, we are not in a high school, but this time we are doing it, but that's not the business or a purpose of an hospital. Cooking for patients. We are not a hotel. In fact, these are things that probably in the future we are not going to be engaging in. Collecting money. We are not a bank. In the future, we are going to outsource those services. Having a laundry machine. Our business, our core business, is to restore people's health and create clinical outcomes. And that's the direction this strategy is going to take us. And I'm certain that with my staff, and I'm certain with our board, and we are certain with the support of the county government, we are going to make JOOTRH to have the greatest and the best clinical outcomes whenever we deal with our patients. Your Excellency, the nurses I have here and the doctors I have here are great. In fact, my nurses, I usually respect them and appreciate them because they are the only human beings on earth who open the eyes of a newborn baby and also close gently the eyes of the dying. They are very special people. In fact, I usually tell them that, you are angels with a stethoscope. My consultants are great men and women. They restore everyone's health. And those who even go and who even pass and leave us, they usually touch them. And therefore, it's our determination to support the community. And therefore, with our strategy, we have one important pillar is actually the community engagement. I think this is probably the only hospital which is going to have a community engagement pillar in its strategy. And it's our belief that people matter. It is the people. It's those people in Kondele, it's those people in Obunga, it's those people who are within our communities that will make us or break us. And that's why we had to go through a public participation to have them participate in this strategy. And therefore, we have even have some resources purposely for community engagement. And that's why the county government of Kisumu, and we thank His Excellency the Governor and Dr. Ganda, they actually allowed us to have Kosao Hospital and also Victoria Hospital to actually support and we are going to open Kosao Hospital in March. And we are going to have our primary health care there, MCH, and probably also other conditions. So, Your Excellency, I don't want to go into the details of this document. The document is available. What we want to commit here is that we are going to execute it 90%. I don't want to say 100%. Because when I push them also very hard, I think my staff, sometimes it becomes a challenge. And what happened is that because when I was the CEO of Kenyatta National Hospital, Professor Nyang'o actually was the one who appointed me the CEO of Kenyatta National Hospital. I used to work with wildlife. I used to manage wildlife, in KWS for 15 years. And when Professor Nyang'o appointed me, the health workers, and in fact the city, everybody was talking about saying that, the staff of Kenyatta National Hospital was so difficult that they needed somebody from wildlife to manage them. But I want to assure you that the staff at JOOTRH are so great. They have supported me, including the universities, Maseno Uzima, and even KMTCs, to make this hospital a great facility. And therefore, I don't intend to push them. In fact, we are going to execute this plan within the 5 years or even before, and we get, 90% execution. Very few organizations in the world, in particular in Africa, and I can say in Kenya, with empirical evidence, only 30% of strategies are implemented actually to a point of 30% execution. But for us, we have integrated our strategy with what we call balanced scorecard approach. Balanced scorecard approach will help us to execute, cascade, and ensure that we implement this strategy 90%. And we will not at most 80%. And that is actually what is very, very important. So with those very few remarks, I want to take the opportunity once again to thank all those who have come here, all those who have participated and supported us, their suppliers, and those who supply us, locally and even internationally, that we are going to continue working together to ensure that we succeed. This strategy has got a gap of about, I think, 29 billion in the next 5 years. 29 billion shillings that we require. It's actually paltry. In fact, Kenyatta National Hospital gap is 89 billion. Ours is only 29 billion. And with Dr. Gandhi,
introduce new services where we do not have adequate services to cover what we are offering for the patients. We are looking at introducing new services and not just introducing them, but having them at very high levels and standards so that our patients are considered getting quality care like they would get in any other private hospital within or without of Kisumu. We are interested in patients' feedback. We are a public hospital, and many times public hospitals, it's assumed that they don't take care of their patients. But we can only improve when we get feedback from patients. So we are very serious about that as part of our strategy, that we want to get feedback from patients and see how we can improve the care that we are giving the patients. Because when we get feedback, then we provide individualized care to patients, and we are able to excel in what we are doing. We are able to get the excellent outcomes that we are looking at. Other than the satisfaction, we are committed to work with the management, at the board and the management, to be able to provide the equipment that is needed to support the excellent services and improve the outcomes. We are committed in supporting in training and whatever else the staff need, so that then we are able to support the services. So we are all together in making sure that we implement the strategy at every level, cascading it from the top to the junior-most staff, because each one's role counts. If the cleaner does not clean the toilet, the patient will get infection. So everyone's role counts, from the board to the rest of the staff. And we are committed to working together with Dr. Lesiampi and the rest of the team at the hospital to just make sure this is achieved. It's a great honor for us, and we're looking forward to greater outcomes for our patients. Thank you.
Thank you very much. Let's put our hands together once again for Mildred. Now it's now my pleasure to welcome the Chair of the Board, Mr. Chila, to make his remarks.
To our Deputy Governor, Dr. Matthew Zuwili, CEC's President, Dr. Gregory Ganda, George Osmomo, members of the County Assembly, and Madam Judy is also present. Thank you very much. Allow me to ride on the protocol which has been set by the CEO, and here to state that JOOTRH today is launching the roadmap, which will translate into proper healthcare service provision in this region, as they have been well stipulated by the CEO. And the backbone of all this is the support we've been having from the governor of Kisumu County, who is the vision bearer. We are just agents of execution. And we have got very good staff who have been the backbone, and they've been working under very extraneous circumstances, given that, you know, we have not been having proper resources. But with the little resources, we have been trained to use that little to give excellent outcome for patients. And I can tell you, JOOTRH is in the right trajectory. We are having a lot of training programs which we have lined up for our staff, which is the main foundation and cornerstone for service provision. We are also dealing a lot with expansion of infrastructure, and recently we opened the Prime Care Center, which is giving services matching Aga Khan Hospital and the rest. We have also expanded to Kosao, which will be dealing mainly with the primary health care, and also Victoria Hospital, which will be offering specialized services in hematology and sickle cell. And in terms of financial sustainability, the hospital has tried a lot. We only rely on FIF, and we have to pay our contracted staff and casuals and other recurrent expenditure. And I can tell you, with the little we have managed, and with this strategy in place, I can assure you we are going to do a lot better. And with the support of the county government, the community, we are sure we are going to bridge the gap of 29 billion to finance the strategic plan. Otherwise, we also thank the County Assembly of Kisumu, who have been very supportive in terms of oversighting us thoroughly to make sure the little money is used well. Thank you very much, Yagongo and your team. And of course, whenever we have an issue which needs legislation, they have never hesitated to pass what helps the running of the hospital. Like, I think the FIF Act, that was a very big plus for the Kisumu County Assembly. With the launching of the strategic plan, we believe sky is the limit. If you look at our logo, it's we fly with the eagles, yeah? And we are going to surpass
you know, an eagle, when an eagle is transforming, it sheds all the feathers, breaks the beaks, the claws, and that's what we decided to do under the new CEO, Dr. Richard Lesiampi, with the support of the staff. And we are very sure the eagle is going to live longer and give better services. Thank you very much, and we appreciate all our guests who have come today, and we call for your support at all levels. Thank you very much.
Thank you very much, Mr. Chila. Can we once again put our hands together to appreciate you? Thank you, Sana. Yeah, Your Excellency, before I allow Mr. Madanje to take over the next phase of this engagement, with your permission, allow me to ask my staff to stand wherever they are. I have to recognize these people. They are great men and women. Yes. Tuwapigie makofi wote. I can see the Director Nursing, makofi kwa Director Nursing Teresa, the Deputy Bishop Betty, pigeni makofi Betty. We are competing with Betty to reduce weight, so I don't know who Mr. Ondu, the procurement man, we call him the money man. Mtu wa procurement, anajaribu sana Mr. Ondu. I think I also have Josephine at the back there. And watu wa procurement. Let's also give a round of applause. We have Nerea. Nerea is actually the head of human capital. We don't have human resources in the JOOTRH. We talk about human capital. We have left what we used to be called personnel, human resources. We talk about. That's why also, Your Excellency, we changed so many of our names. Because in African culture, names, and titles mean a lot. So the name of mortuary, we threw it away. We have a farewell home. Some of my staff who had titles, mortuary attendant, mortuary officer, wherever they are in the community, when they ask, why are you working? Unafanya kazi wapi? They don't say. But nowadays, they actually say that, he is working at JOOTRH, is a farewell executive. So you can't tell. In fact, even the support staff, who used to clean the floors. Yeah, those also who clean the floors, who clean the windows, we have actually changed their titles. They are called the window technicians, floor technicians. Because these titles are very, very important, and that's why we have human capital. In fact, even in infrastructure, we don't have anything called infrastructure now. We call it techno-innovation. Yeah, so I also have Dr. Ngonga. Dr. Ngonga is the director in charge of clinical services here. I have Evans Olo, is actually the senior administrator in the hospital. I also have my great secretary, Christine Ayuga, and I want to thank Dr. Ganda, who actually brought her, gave me. I have never had a secretary, and it was unfortunate. I'm going to a very high level in government, so I was operating without a secretary. It became a challenge. So he brought me Ayuga. She's actually more senior than me because she allows you either to see me or not see me. I also have Joshua Clinton, Asante Sana. Joshua Clinton is in charge of Director of Finance. The rest, I also have doctors. I also have med-subs from different hospitals. We have Maseno University here. We have Uzima University. We work very, very closely with them. And therefore, I want to appreciate all of you. Let's give them a round of applause for transforming JOOTRH. Once again, let me call the chair. He did not introduce his board. Wachapasa PNI introduced board. And one of the board members here, Judith Adwoj, the minister, I think CC also water, he really supported us. In fact, we have been dreaming of having a borehole at JOOTRH. I know Kiwasko is around here. I actually massaged the egos. I told them, even if we get enough water, I'll continue getting some water from you, so that I pay you some bills. So they are allowed us actually to drill a borehole, and with the support of the county government, support of duty, we drill the borehole. I'm told that the possibility of getting about 30 to 40 cubic meters per hour is there. I'm not sure. And if it's going to happen to be 40 cubic meters per hour, we are going to supply water to Kisumu County from JOOTRH. But you're also looking forward. Okay. We are also going to continue working with the county government to see to it that we get enough water to support this. Now, before we call the board, I also have a number of partners here. I think, please, I want to request them to stand wherever they are. There are partners who have partnered with us because, Your Excellency, we say in JOOTRH, we either partner or we perish. So we have decided to partner. Tafadhali, wherever you are, our partners, just stand for us to recognize you and appreciate you. Yes. Yes, I can see. Very good. I think you can give them a mic, you know. I think this mic can take it very quickly. Go there. Here. Yes, you can start.
Good afternoon. Dr. Simon Musongo, Medical Director, Kisumu.
Good afternoon, everybody. Rita Dashahe, Business and Communication Manager at the Car Hospital, Kisumu. Good afternoon. Jane Onyewa, CEO of the Car Hospital, Kisumu.
Good afternoon. Sheila Otieno, Executive Director, Compassion FM.
Good afternoon. Josephine Olan, Palliative Care Coordinator and Medical Outreach in CCF Center.
Hello, good afternoon. I'm Lucy Waliera from Kenya Red Cross.
Good afternoon. My name is Alex Mwaki, Director, Safe Water and AIDS Project.
Good afternoon. Alice Okwuzi, Branch Manager, Equity Bank, Kisumu branch.
Good afternoon. Philip Nyaswa, Deputy Vice Chancellor, Resource Mobilization, Quality Assurance, Partnerships with the University.
John Okere, Deputy CEO, Keynote. Maurice Casera, Regional Corporate Relationship Manager, KCB Bank, Western.
Good afternoon. I'm Prudence Mabuya from Kiwaso. Good afternoon. I'm Fatma Hussein from Suke, Kisumu County.
Good afternoon. I'm Rose Wanga Ouko, Anchor of Hope, JOOTRH, Cancer Support Group. Thank you. I'm the counselor, psychologist of Thank you.
Thank you very much. Yes, we also have other partners. I think Maseno University. I think I saw Dr. Masawa here, who is also part of JOOTRH. I'll tell you about it. Yes. Any other partner? Yeah, we want to thank all of you. We want to say that the JOOTRH, for example, Avenue, we already went to sign an MOU with Avenue. To work together, collaborate together, in terms of the services we provide to the people of Kisumu and Western Kenya. The same with Aga Khan. I think we're also making arrangements to have an MOU so that we can work and collaborate together. Going forward, we also want to see that all medics in Kisumu County, come together, particularly when I heard Dr. Gandas talking about kidney transplant. We need to have all those guys in those specialties. We work together, we have a center, we all do those kidney transplants. We have a center, even maybe to conduct bone marrow transplants. We also have a center where all of us engage, to manage cancer issues. I think all these things we can do collaboratively, and we are not engaging in any competition. So with that, I also want to introduce my two brothers. I didn't want to introduce them. I wanted somebody else to do it officially, I think Madanje. But when I go back to the village, probably they will say, Bwana, you are there and you did not introduce us. He's good. They are going to be introduced officially, but let him stand here. He's called, he's the County Commissioner of Kisumu. We are together in school. He's called Parmorijo. He graduated, all of us where we come from. You graduate as a cattle rustler. You become a bandit. But luckily for the two of us, we went to school, and that's why. So we come from the same village, we come together, and every once in a while, we have to meet him together with Ole Marai. Where is Ole Marai? The OCPD. Ole Marai also, he's a brother of mine, he's from Kigori. We are about 55 of us in Western Kenya, and we usually meet because we also miss the nyama choma, we miss the goats. So we meet once in a month for mbuzi only and soup. And we also have a Mary go round, and we also have a Joseph go round. So I'm very excited also for my brother here. I've insisted to them one thing, that by the time we go back out of Kisumu, we must speak the Luo language. So, but I've not told them that the condition that you must have a resident tutor. No. So I think with that, thank you very much. Thank you, Your Excellency. Let me now ask the chair of the board to invite the board members aside.
Thank you very much, CEO, for the commercial break. I would request the present board members of JOOTRH to come forward, please. So that you introduce yourself and you are seen by our guest partners and our co-sponsor, the county government and the appointing authority. Dr. Gandaka, right now you are under our. Thank you very much. So, CEO, you are also secretary to the board. Okay. So I'll start with.
Hello, good afternoon to you all. And my name is Herbert Okalo. I'm in charge of infrastructure. I, first of all, thought that you had forgotten about us, Chair. You have seen the infrastructure, how it is in the hospital. I'm the one in charge.
I had been introduced earlier. Good afternoon. I'm Mildred Odhiambo. I'm in charge of clinical research and quality. That's excellence. We must achieve it.
Good afternoon, colleagues. My name is Chini, practicing member, clinical, and human capital. Thank you very much.
To Your Excellency, the Deputy Governor, and everyone, good afternoon.
Good afternoon.
My name is Julie Tolot, and I sit in the board. I actually represent the office of the Governor in the board. So you realize that even during the gazettement, it was actually listed as the minister in the office of the governor. So for me, I support all the committees, and I'm proud to be in this board, and to really want to thank Dr. Ganda and Dr. Esiapi. You're making us proud. And Dr. Esiapi exemplifies the change that we always want to see. Thank you very much. To all the board members, asanteni. Some of us sometimes don't have the time, but you're always there. Asanteni.
I'm being advised.
I'm the secretary of the board.
Yes, there are some two board members who are not here. We have the chair of the board, Doris Obara. She went to the US on some mission. She should be back by June, but she still joins the board meetings through technology, through Zoom. And then we have Tom Were, who is unfortunately couldn't make it. He is the chair of the strategy committee. He's also a CEO of one of the NGOs around here, ACT. Yes. So we are very qualified board members. And myself, Dr. Ganda, I will speak later. I'm also a board member.
Okay, thank you very much. My name is Dr. Richard Siampe. I'm the CEO of the hospital and also the secretary of the board. I don't think I have anything else to add. I also have another friend that I have just seen. Please allow me, Your Excellency, Mr. Otieno, just stand. Mr. Otieno, we work with him. I've been in so many places. I worked with Mr. Otieno at Cooperative Bank of Kenya, very many years ago. In fact, I think 1994, 95, 96, 97. So I met him today. You know, I'm very, very excited. When I saw him, I remember the 504 card. He had KAA, I don't remember the other number. And he actually inducted me in the banking industry. Unfortunately, I was not very comfortable with money business. I was from Kenya Wildlife Service. I told them I'm resigning. I'm going to take care of wildlife and not money. So I'm happy, asante sana, and thank you for allowing me to say something. Thank you very much, Excellency.
Yeah, I think we have 3 other board members whom we co-opted. The CEO of KMTC, local KMTC here, and then we have the Dean Maseno University, Dean of Medical Services, the Dean Usima University, and then a representative from the local SHA office, the regional manager. Thank you.
Let's give the board member a
And for the job my brother Richard is doing in Jaramogi and the management. How many are happy with the job they are doing in Jaramogi? Beautiful. Let's give him another round of applause. He has transformed the place, transformed even the titles. I was even being told that drivers are called pilots. Right. Now, in Kisumu County, Kisumu government is under the party, one of the most powerful party called OD. I want to hear OD. We are privileged to have the chair of the Kisumu County, and I want him just to introduce himself. He was a boss of Mr. Richard here at the bank. And I'm proud of him. He has a lot of networks. I'm seeing the partners, serious partners here. No wonder. Honorable Paul Akeyo, just to greet us as a chair of the party and give us some hope.
Thank you, Your Excellency, the Deputy Governor, the CEO, the board members, the county commissioner, who is also a friend of mine, and all other guests. Good afternoon. Good afternoon. I think I don't have much to say, but I want to say one thing, that I'm also a partner at Jaramogi Oginga Odinga. And as you are counting on the partners, I will be a very good partner to make sure that we do not have any demonstrations to interfere with the affairs of. So I'm also a very great partner. And I must say that even to the county government we have here in Kisumu, actually I'm a partner, and I'm very impressed that the county government is working very hard and have a report to give back to our people that this is the government we put in place, and they are doing a lot for us. Lastly, I would request Richard. He's a person I've known. I've worked in Samburu and even the county commissioner and all. I worked for you in Samburu so hard, and I would expect and I encourage you also to give our people here the same services I did to your people. Thank you.
Thank you, Chairman. Now it's my pleasure to invite the Chair of the Health Committee from the Assembly, Honorable Vincent Jagongo Chopper. Karibu, makofi kwake.
Thank you. Your Excellency, the Deputy Governor, Dr. Matthew Sowili, Dr. Ganda, the CEC for Health, the CEO, Dr. Lesiampe, and all the protocol observed. Good afternoon. I want to say that I'm a happy man this afternoon because of the transformation that I've seen. We were invited here as an assembly, the Committee of Health, but due to some commitment, we only managed to come, the two of us. So we are with the Honorable Seto Kumu, just standard wave. He is a member of the Health Committee, thank you, and a member of County Assembly for East Seme. I want to thank the JOOTRH team for the good work that you've done so far. I was elected as a member of County Assembly in 2017, and then I became the chair of health in that same year. And I can remember we used to have so many complaints coming from JOOTRH and the health department. We used to have to solve cases from healthcare workers and also community members. There were several petitions. In a week, we could even have 5 petitions from the community members about the Department of Health, and also from the staffs within the JOOTRH and within Kisumu County. Nowadays, I'm a very peaceful man because I don't receive those petitions. And that means you've been doing a wonderful job. I want to thank the CEC for help for this transformation, and also the CEO of JOOTRH. We as an assembly, we are ready to support whether it comes to we've passed almost 6 bills in the assembly that are now act that support county, and we believe we are still ready to support other bills so that we can strengthen our healthcare in Kisumu County. So I'm happy with the vision of excellent clinical outcomes. I don't know what was the vision before. I don't know whether this was the vision before or this a new vision.
Before it was flying high.
So before it was flying high, which we failed to fly high, now we are excellent for clinical outcomes. So as an assembly, we want to support you. Last financial year, we passed a budget of 600 million to support the activities within JOOTRH. But I said in the morning that we are still willing to support, whether you bring a supplementary budget to supplement the budget that we passed, so that you continue getting good money to support your services. But the ultimate goal should be the elevation of the JOOTRH level 6. Let it come, money follows functions. So let that money come, because now we have the functions, we are only waiting for the money to come. So we want to plead with the national government to actualize our dream of level 6 by supporting us financially so that we can be stable as a facility, so that we can also extend more services to our people. So us is to oversight, consult. So we'll do oversighting by even consulting. So if you don't see the chairman, sometimes he consult on a low tone that the media may not consultation, so that we can better our facilities, we can better our health care services. I want to close by saying that we have a commitment to support healthcare as an assembly, so that we move our people and we give services, quality services to our people. Asanteni sana.
Thank you, Mheshimiwa. Makofi mazuri kwa Mheshimiwa. It's now my pleasure to invite Honorable Dr. Ganda, the CEC in charge of the department, to take out the program, recognize his colleague, and proceed with the program from there. Welcome.
I usually scare people, that's why they don't clap. So you can clap now. Is it afternoon? Good afternoon, ladies and gentlemen. Yes, I'm very excited to be here today. But before I speak, allow me to introduce my cabinet colleagues. Starting with the CEC in charge of finance, Mr. George Okongo. Makofi kwake tafadhali. And the CEC in charge of public administration and many, many things, JOOTRH. Forgive me, DG, you know, I don't know, I don't have a very good memory like you. You usually are able to spell out all those departments by word. There are some CHMT members and sub-county health management and HMT members who are here. MedSups, are you here? Oh, they're not here. Where? Oh, you stand up. Thank you, Pamela and team. Thank you from Migosi, Makofi. Thank you, everyone who has found time to be here today. I don't have a long speech today. I want to start by thanking my cabinet colleagues, starting with Mr. George Okongo and JOOTRH. There are many things that you don't see. When you see things happening, there are many things that have to happen behind the back. I know George has been very favorable to JOOTRH. You might not know that JOOTRH has been favored a lot to get them out of several quagmires whenever there are financial distresses. And in fact, JOOTRH got its permission to start spending their money even before the rest of the facilities did. And it is because of the commitment of the Department of Finance towards JOOTRH. Judith has always been there with me from the beginning. Nothing comes from nothing. Everything starts from a vision. And of course, that vision was the governor's vision. And Judy has helped us, start of all, to get the right leadership in place. It is not a walk in the park to get good board members. We started from that point to make sure that we had a very good selection of board members into JOOTRH. Then we went into the selection of the CEO for JOOTRH. And today, we are seeing the fruits of those selections because they have done an outstanding job. We are very proud of them. Makofi kwao tafadhali. Thank you very much, board members of JOOTRH, for the transformation we are seeing. These days, we actually don't need to attend all board meetings. We thought that we were going to be there to spoon feed, but we found that within a very short time, these board members had taken off and JOOTRH was running into the right direction. I want to say a special thank you to Lesiampe, the CEO of JOOTRH, because it was my task to look for him and hunt him down. Kisumu County could not afford to have somebody the caliber of Lesiampe. And it went down to a one-on-one talk, and his commitment to help Professor Nyong'o to do something for Kisumu County. Whatever we give him is not commensurate to the expertise that he has. But he has just come to help us. And he said, I will come and help you to do that transformation. Because we were at a very difficult point. You have seen that, first of all, we didn't even have a proper vision. We knew what we wanted. But to transform it into anything was very difficult. I'm his boss, but he's also my teacher. He has taught us a lot about human resource management and about corporate management, and transformed JOOTRH into a facility that we are now proud of. Long time ago, if you are going, I got a call from the DG, I knew there was a problem, and that problem was most likely going to be JOOTRH. But these days I don't get calls. In fact, those who call me, I tell people these days, you call me that I have a patient, blah, 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 what I say, I will sort it out. I don't do anything. After an hour, they call me and say, thank you very much. You've sorted out my problem. Because things work. Things work. If you land over there, things will work. The only thing I'll ask JOOTRH right now is to look at how referrals can be more effective, especially booking for special clinics. And yesterday I told the CRP about KUTRH, that you can actually call Kenyatta University Teaching and Referral Hospital and book for an appointment if you're a cancer patient. So that I don't need to have somebody from Moroni come to JOOTRH physically to book to see a doctor. He should come to see the doctor on that day. And I think with telemedicine, with telephone, with all these innovations, we are ready. JOOTRH should be a referral facility. And there is no way somebody from Migori should travel in the name of coming to book for a clinic. You come here on Monday, then you are told, okay, fine, you come next month, on 22nd is when you will see the doctor. That is a lot of waste of time and inconvenience to the patient. So once we start smoothing out that, then our clients will start benefiting from efficiency of the services. I'm very happy that he also now has daily consultant clinics. That's a problem we had. We used to have 1 or 2 days for specialists, but now we have specialist clinics. And that actually increases the what's it called? The reach or the access to specialist services in this region. I want to pay a special thanks also to the Assembly, because they have been very good to the Department of Health. They have taken the decisions that needed to be taken. When things were very difficult in passing the FIF Act, they were there. When it comes to oversight, I've seen we have greatly improved in terms of our audit queries. Last time I had 5 facilities that are diverse. Now they have gone down to 2. and all our facilities have actually improved. And you can see the improvement in terms of financial accountability. But this is really the work of the assembly, because we supervise them, but we don't oversight them. So the fact that they have to go and answer questions about how they are spending their finances is actually improving the accountability. And accountability is a very, very important issue in terms of the ecosystem. So when you see all this happening, it is not the work of a few things happening. It is an whole ecosystem which actually has to work. And I usually tell my people, my colleagues, that we are very lucky in Kisumu because we don't have an assembly that is hunting down air. You know, the people who just look for you for no apparent reasons. We have a very objective assembly. We have a very professional assembly, and that's why we consult and we work together. All of us have that vision in mind. Dr. Lesiampe, again, thank you for transforming the vision of what we thought JOOTRH should be. A referral hospital, specialist services, center of excellence. You have now transformed it into a strategy that anybody who comes even after you will be able to follow so that we reach that down that level. We are giving you COSAO because we want to remove the idea of community health workers attached to JOOTRH, because JOOTRH has no business with community health workers. Now you have COSAO where the community health workers will attach to you. JOOTRH will receive referrals and your next partner will be the facilities referring to you. Otherwise then, you have Kondele being favored because they are next to JOOTRH, which is different from Kombewa, which does not have access to JOOTRH. There should be equity, so that COSAO will serve those people, and I'm happy you have taken up. I hope, as you promised by March, COSAO should start operating. We are also behind the scenes looking for financing from you, from some of our partners, so that we can do that project and complete it. I know I have a partner who might give us 50 million. So that is one of the projects that we are considering to complete. Finally, the whole health system is about creating resilience. I'm very proud of the system that we have. I know WHO have not shared this document, but out of the facilities in the world that were chosen for case studies, Kisumu County was one of the ones in the world chosen for case study. And there's actually a case study on the socio-political environment that actually creates a working health system. It's actually published, and I will share with you people. And in Kenya, we only had Garissa and Kisumu, because Garissa has some strange way in which they are handling their primary healthcare facilities. And that means work has gone on. The politics and the economy of this has been able to drive something in the primary healthcare system that others are able to see. We have had benchmarking from several countries. Burkina Faso, Mali, Cote d'Ivoire have all come to here, to Kisumu, to benchmark on how is this that these guys are running the primary healthcare facilities. Yesterday I was invited by the national government to talk about how we are doing on cervical cancer, because it's a benchmark for the whole country. We are also benchmarked for HPV vaccination in this country, because again we have the backing of the governor, we have the backing of the First Lady, and the whole system is actually looking at the health of these people. This system is going to be tested, because the primary healthcare system is about resilience. When the US government has withdrawn its funds, I was in a crisis meeting this morning when I was told that all the US government staff in Kombewa have been told to start working immediately. And so the Metsu called me having panicked that a third of his staff are not going to come to work today. And so that's why my chief officer is not here, director. They've had to go to Kombewa to find out how we are going to sort out. But I believe that we shall make it. The systems that we've created shall actually work. It is time we are going to test them. Finally, my sincere appreciation to His Excellency the Governor and the Deputy Governor for always supporting the Department of Health. You know, health has always been the heart of the Governor and His Excellency the Deputy Governor. And he has never missed any function in JOOTRH, just as Lesiampe said. And of course, there are two people who never miss anything to do with health from the Assembly. Jagongo has never missed, and Seth Okumu has never missed. Seth was my schoolmate in Moi. And I'm very makofi kwake tafadhali. Behind the scenes, he supports me. He listens. And so we have very, very good people in the government who are supporting us to do this. With those many remarks, allow me now to welcome our county commissioner. That name, Leopard, something. Always miss it. To come and say a word to us. Let's give him a hand clap as he comes in. Karibu County Commissioner. Thank you.
Asante sana. Our chief guest today, His Excellency Dr. Matthew Sowili, our Deputy Governor for the great county of Kisumu, our CEC Health, Dr. Gregory Ganda, at the Honorable CEC's President, our Honorable members of the County Assembly, our CEO, JOOTRH, Dr. Richard Lesiambe, the members of the board, all the partners, my brother Mr. Peter Mlai, is our sub-county police commander, and all other guests. Mine is to thank His Excellency the Deputy Governor for having found the time to grace today's occasion. I think we started with the facility, and now we are here to launch the strategy. I also want in a special way to thank our CEO for the wonderful work he's doing in this facility. Thank you for the commitment, the passion you have for this job. Thank you, Bwana Chairman, ODM Chairman. I think in the spirit of reciprocity and maturity, tutarudisha mkono. Tutafanya kazi kwa bidii. So thank you, Bwana Chairman. Tunashukuru with the broad-based government. Now we are working well together for the common good. So asante sana, you know, with the strategy spells out the goals of the organization, the objectives, the vision and the mission. All those are very clear. So this is an institution that is a center of excellence in specialized health services. And so we are proud to be seated with this institution. It has a very big catchment. It started way back in 1965. The catchment is so big that 10 million is not a small figure. And even the patients that come for outpatient services, that number of over 200,000 annually is a big number. Even the inpatients, the 16,000 and plus, those are big numbers. We want to thank all the staff. All of them are doing a wonderful job. We see very good teamwork, a lot of commitment in the good work that they are doing. And that's why people come from all over to seek medical services. I've looked at the core values, and I've never seen compassion in any other organization. That word compassion. The rest are always there, but compassion, I think I'm seeing it for the first time. And we say thank you. The strategy I've just tried to look through. You know, producing such a strategy is so involving. It involves a lot of think tank. And it is smart. We have seen it. It is coherent. It has even mentioned about the challenges, especially the budget, which is over 60 billion to implement the whole thing. So it is clear and it is smart. And so we say thank you for the strategy. And you know, normally they say when you do not plan, then you plan to fail. So I think with this strategy, which is very clear, very specific, I think the CEO and his team will achieve the intended goals. So tunasema asante. I think you've also done the SWOT analysis. So all this will ensure you meet your goals. Normally they say whatever gets measured gets done. So with that I say thank you. And maybe may I now take this opportunity to welcome our chief guest to address us. Can we be upstanding as we welcome His Excellency Regina? Tumkaribishe moja. Karibu, Your Excellency. Karibu sana.
I think before you resume your seats, let's give a round of applause to the County Commissioner Moja. You may resume your seats. So the County Commissioner, County of Kisumu, our very good friend, the Honorable Bernard Leparmorijo, Dr. Dan. CEC in charge of Health and Sanitation, Dr. Greg Ganda. CEC in charge of Finance, Economic Planning, the Honorable George Omondi Okongo. The CEC in charge of Public Service, County Administration, and Participatory Development, the Honorable Judith Oluoch. Allow me also now to recognize the presence of the CEO of JOOTRH, the Honorable Dr. Richard Lesiampe, together with your team. The board, and I recognize the presence of the Honorable Kasuku Achila, who is chairing the board in the interim, in the absence of Dr. Ombara. Our most valued partners, including the Assembly. We work together very closely with you, Dr. Jagongo, together with the Honorable Senator Kumu. I was in your ward last week, the party, and indeed all partners who are here. The Aga Khan, Jen, Kesa, and your team, we appreciate you. We don't know who is remaining in Aga Khan because I can see all top level managers are here. Okay? We appreciate your presence and your partnership. Uzima, Mo University, Equity, I mean all of you, including the angels with stethoscopes. Good afternoon. Now, Professor Peter Anyanyungu was our chief guest today. But as you know, commitments, especially if you're a county governor, arise, sometimes unplanned. Okay, so up to yesterday evening, he was still going to preside over this, but something came up, Dr. Siampe. So he asked me to come in and stand in for him, and I hope that is acceptable on this very big day. So the following are the remarks of the governor of the county of Kisumu on this day. Today marks a significant milestone in our journey towards the development of the Jaramogi Oginga Odinga Teaching and Referral Hospital Strategy 2024 to 2029. As we gather to celebrate the launch of the strategy, we are reminded of the collective effort and the unwavering dedication that has brought this to the moment. I want to extend my heartfelt gratitude to all those who have played a crucial role in making this launch possible. To our partners, our sponsors, our staff, and our supporters, thank you for your invaluable contribution and also for your collaboration. To our team, whose hard work and perseverance have been the driving force behind this initiative, your commitment and passion are truly commendable. And Dr. Siame, please take this from us, from deep inside our heart. I think just like the other people have said, we like the direction that things are taking at JOOTRH. Tuwapigie makofi. Yeah, the only thing you need to know is that Luos are also lovers of meat and soup. Before we migrated to Kenya, by the way, we were, I think more like you guys in terms of our love for meat, until we discovered fish. We colleagues. Yeah. Now, earlier this morning, on behalf of the governor, I opened a refurbished accident and emergency wing at Jaramogi. I also commissioned 7 new dialysis beds, and I want to congratulate the CEO and his team for these great achievements. Ladies and gentlemen, the launch of this strategy is a testament to our commitment to achieving excellent clinical outcomes. Now, this initiative is designed to provide accessible, responsive, quality specialized medical services, training and research, and to create a positive impact on society. By implementing this strategy, we are paving the way for a brighter and more sustainable future for all. Now, this strategy will be implemented through the leadership and governance enhanced focus and effective resource allocation, operational excellence, quality health services, and prompt delivery of services. We shall also do it through the allocation of resources for service delivery, community engagement, expansion of accident and emergency center, and also increasing the number of dialysis machines from 7 to 14. Our primary objective with the strategy are to address the diverse health challenges facing the community, from strengthening primary health care to tackling maternal health, non-communicable diseases, and infectious disease prevention. Ladies and gentlemen, the strategy emphasizes on technology, continuous learning, and is very patient-centered. Now, these goals align with our broader vision of creating a healthier and more equitable future for every resident of Kisumu. And I realize not just residents of Kisumu. In my interview with the patients there today, I have noticed that we have people from other counties, okay? And notably CI, at least for today. But I know people come from everywhere, Migori and all this kind of things. So what we are doing today, the investment and the strategy we are launching is not really just for Kisumu, but I believe for the region and for the country. Now further, the benefits of this initiative are manifold, including a focus on expanding access, improving clinical outcomes, and promoting preventive care. It resonates deeply with our manifesto commitment to health services, which will undoubtedly contribute to the overall development and well-being of our community. As we embark on this new chapter, I call upon each one of you to actively engage and support this initiative. Your involvement and contributions are vital to the success of the plan that we're just about to launch. Now together, we achieve a remarkable outcome and make a meaningful difference in the lives of the many people. In conclusion, let us celebrate this momentous occasion with a sense of pride and also a sense of optimism. Let us look ahead with renewed determination and confidence, knowing that we are united in our vision and also in our mission. I want to thank you on behalf of the governor for being part of the transformative journey. Together, we will create a lasting legacy for future generations. And Dr. Siampea and Dr. Ganda, unknown to you, we talk about JOOTRH in many places. Today, in a meeting that we had in the morning with the 2 ministers sitting behind you there, we were basically talking about JOOTRH in a meeting that we would have talked about other things. Actually, the meeting was about environment, okay? But we thought there was an opportunity to engage with the official that we are meeting about, JOOTRH as a level 6 facility. I know that in terms of our operations, we're already there, but our prayer is that one day it will be taken over in the sense of a budget after the gazettement that you're saying, so that Dr. Ganda and of course Waziri George there can then think about improving especially the human resource team in the county out of what we probably would have saved, for lack of a better word, if this were to be the case. Hopefully a meeting may happen next week just to be able to engage with Treasury so that we can have some kind of timeline on when that happens. Now, other than that, we are also aware that there's quite a bit that remains, undone, okay? our comprehensive cancer center, okay, is still a dream that we may need to achieve. We have been talking about, sickle cell center, okay, bone marrow transplant center, all these things that will really make us operate at that level. I believe that, Dr. Ganda, working together with yourself and the team here, that is a dream that we must achieve in the fullness of time. So that will conclude my remarks, and of course the remarks of the Governor of Kisumu, and I would like to call you up front so that you can tell us the next steps in as far as the launch of this plan is concerned.
Thank you very much. Round of applause to the DG. And now we are getting to the climax, and I politely request the CEO to come over. The DG is here so that we can do the official. Please remove the rostrum, please. County Commissioner, please. Up.
And now, ladies and gentlemen, on behalf of the Governor of the County of Kisumu, I now cut this ribbon to officially launch Jaramogi Oginga Odinga Teaching and Referral Hospital Strategic 2024-2029.
Thank you. Now, the board members, yes,
One part, the partners,
CEO Agakan, Jane, Sheila,
one community star, one community.
Sheila is also representing Red Cross Board. Good. Yeah, I think, Jatosha.
It's okay. We can take one down.
Spread out on the spread out the logo so that the results. County Assembly. Chair. Yeah, pass. Good. Okay.
Take another one.
Akili zangu nguvu zangu nimeziweka mbele yako, bibi yangu na watoto nimewaweka mbele yako, tabu zangu shida zangu ziangalie, tabu zangu shida zangu ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Matajiri masikini sisi zote binadamu. Matajiri masikini sisi zote binadamu. tusahau majivuno na tuache kupayuka. Tusahau majivuno na tuache kupayuka. Utajiri majivuno siyo tikiti ya mbinguni. Utajiri majivuno siyo tikiti ya mbinguni. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Bahati yako ni ya leo, ile ya kesho ndiyo yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Mwarifu twakujua, mwarifu twakuona tu. Mwarifu twakujua, mwarifu twakuona tu. Plani zako twazijua, lengo lako twalijua tu. Plani zako twazijua, lengo lako twalijua tu. Wataka kunyamba Kenya we, utuharibiewa. Wataka kunyamba Kenya we, utuharibiewa. Harufu yako twaijua, hata ukipanda ndege. Harufu yako twaijua tu, hata ukipanda ndege. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya yangu usijali, ukitukanwa na jirani. Kenya yangu usijali, ukitukanwa na jirani. Yeye anaona wivu kwa vile umeendelea. Yeye anaona wivu kwa vile umeendelea. Anakuita nyang'au, amekuita mnyonyaji. Anakuita nyang'au, amekuita mnyonyaji. Naye yazidi kuporomoka, wacha yeye yaporomoke. Naye yazidi kuporomoka, wacha yeye yaporomoke. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni.
President, our CEO, the County Assembly of Kisumu, may I take this opportunity to thank you very much for honoring this particular occasion, and we honor your coming here. Once again, let me take this opportunity to welcome our partners. Let us appreciate our partners. Let us also appreciate the staff of JOOTRH. And finally, I want to really thank God for guiding us throughout this journey, and we are very, very hopeful that God is going to enable us to implement this particular strategic plan. Without much ado, ladies and gentlemen, allow me welcome Madam Betty to give us a closing prayer. Thereafter, we request us that will remain upstanding as our Deputy Governor will be leaving, and the rest will be given further directions. So,
yeah, it's my pleasure now to present the strategy to our Deputy Governor so that he can present it to His Excellency Professor Anyang'o. Takanda You are supposed to be the witnesses. George. Chair, where are you? Chair of the board. This strategy allows State, taking His Excellency, to keep it in his office and ensure that he monitors us for the next 5 years. Thank you.
Makofi mazuri. Let's do it better. Makofi mazuri. Thank you. Let's appreciate them, please. We have lunch after this, so please don't get tired. Appreciate them.
Thank you.
Thank you very much. Let us be upstanding for a national anthem.
Seeing your mighty hand and your presence working with us, O Father, to the realization of the strategic plan. At every step, O God, towards the implementation of the strategic plan. Your mighty hand will walk with us. Your presence will guide us all through. That as our CEO has dedicated the implementation of 90%, my Father, we shall realize that because we are with you, and therefore give us the courage to walk forward. As we have reached the end of God, we want to commit every other person before you. Our Excellency and all guests that are here, we commit them before you, that as we leave, may your journey mercies go with us. There is provision that has been provided. As we partake of it, God, may you bless it. And this is our prayer this day. May you receive it. In Jesus' name we pray.
Amen. Let us remain upstanding as we allow our dignitaries to go for lunch.
Kenya baba yangu, ewe Kenya mama yangu, sitakuacha milele. Kenya we ni baba yangu, Kenya we ni baba yangu, Kenya we ni mama yangu, Kenya we ni mama yangu. Wacha wao waporomoke, wacha wao waporomoke. Viongozi wetu tuombeni, viongozi wetu tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Wananchi tuombeni, wananchi tuombeni. Wacha wao waporomoke, wacha wao waporomoke. Majeshi yetu kuweni macho, majeshi yetu kuweni macho. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke, wacha wao waporomoke. Wacha wao waporomoke. Ninaimba sio wimbo, ni maombi, nikiomba Mwenyezi Mungu ibariki Kenya yangu, kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Kwa jina la Baba na la Mwana Roho Mtakatifu, amina. Ewe Kenya nchi yangu, Ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Akili zangu nguvu zangu, oh, nimeziweka mbele yako. Bibi yangu na watoto nimewaweka mbele yako. Tabu zangu shida zangu, oh, ziangalie Kenya yangu. Tabu zangu shida zangu, oh, ziangalie Kenya yangu. Ewe Kenya inji yangu, ewe Kenya baba yangu, ewe Kenya mama yangu, oh, sitakuacha milele. Matajiri masikini, oh,